Hello everyone. So in this video we are going to talk about hypothermia. As we already discussed, core body temperature is something that is maintained between 36 to 37.5 degrees Celsius. Hypothermia occurs when the core body temperature falls below 35 degrees Celsius, that is 95 degree Fahrenheit. Now, hypothermia can be either the primary hypothermia or secondary hypothermia. Primary is when which occurs following a overwhelming cold exposure, and secondary hypothermia occurs secondary to these diseases like hypothyroidism, where there is decreased basal metabolic rate, burns, hypoglycemia, and Addison's disease. Okay, also in alcoholic intoxication, we see secondary hypothermia. Talking about the stages, we have 5 stages in hypothermia. The first one and the second one are most important to be remembered. The first one is mild case, where the temperature is between 32 to 35 degrees Celsius. Important point to note here is that body's compensatory mechanisms are working. Okay, so patient has a normal mental status as well as the shivering is present. Consider a patient is trying to compensate for hypothermia. There will be increased metabolic rate for thermogenesis. Also, there will be increased ventilation and tachycardia. Consider yourself coming out of a cold water. You have dysarthria and loss of coordination. This also occurs in a patient who is in hypothermia and is in a compensatory mild stage. He has dysarthria and also ataxia plus loss of coordination. Now let's talk about the second stage, that is moderate stage, a temperature between 28 to 32 degrees Celsius. Here body's compensatory mechanisms are failing, means there will be no shivering and the patient has developed an abnormal mental status. Okay, so as the body is not trying to compensate anymore, the respiratory rate starts to fall, bradycardia occurs. If we observe the pupils, they are dilated, and patient also has dysrhythmia sometimes. Talking about the severe stage, that is further categorized into 3, 4 and 5 based on the temperature grading. Less than 28 degrees Celsius is when the patient goes unconscious. Okay, but still we can resuscitate him. Below 24 degrees Celsius is known as fourth stage. Here the patient is unconscious as well as in coma, but still the resuscitation is sometimes possible. We need to remember here the 2F and 2A. F for fixed pupil, flat EEG, and A for apnea and asystole. These are the symptoms which are seen in the coma patient in the hypothermia. The final or the fifth stage is irreversible stage, when the temperature goes below 37.5 degrees Celsius. Okay, so these were the stages of hypothermia and types of hypothermia. Now let's see what are the ECG features in hypothermia. So in ECG we see classical features that are a prolongation of QR interval. Okay, we see prolongation of RR interval. We also see prolongation of QT interval and PR interval. These all occur because of slowing of impulse conduction through potassium channels. A classical feature in the ECG is J or Osborne wave, that is elevation of ST segment. Now, this is classical in case of hypothermia, and elevation of Osborne wave is proportional to degree of hypothermia. So these were some important points in hypothermia. Now let's talk about management of this condition. The first thing first, we have to manage the airway, breathing and circulation, following which we have to prevent the further heat loss in the patient. Then we go for rewarming. The rewarming can be either passive or active. In the passive processes, the patient himself goes for endogenous heat production. How that is so? He goes for shivering and increased metabolism that leads to thermogenesis. Now we can also decrease the heat loss passively. How? We have to remove the patient from the cold surrounding and we have to provide him warm blankets. Talking about the active processes, they can be either external or internal. External active processes include heating the body surfaces or providing heating blankets or radiant warmers. How do we internally what is an active internal rewarming? We give warm IV fluids, warm humid oxygen, We go for lavage that can be peritoneal or gastric lavage that are very helpful in this case. We can also go for extracorporeal circulatory with rewarming. Okay, so these are some of the things we needed to know about hypothermia and its management. Thanks for watching.